Hello friends, let's today talk about scoliosis. Scoliosis in simple words is sideways tilting of the spine. It has also been called as the curved spine. Normally, first sign of scoliosis is uneven shoulders or a tilted pelvis, commonly called as tilted waistline. Now, when we talk about scoliosis, this patient normally presents in two sort of curves. One is the S-shaped curve and the other is a C-shaped curve. Now there are different types of and different causes for scoliosis. In simple sense, scoliosis is a structural deformity of the spine and it can slowly increase with growth if not treated on time. Now first of all, let's understand who are more prone for scoliosis. Normally, children and teenagers are most commonly seen with scoliosis. It is rare in adults, but yes, it can happen in adults also. And there is a variation of scoliosis that can happen later on in the life, which is known as degenerative scoliosis. But majority of the cases that we see today are because of problem happening in the children, which is most commonly because of a condition known as idiopathic scoliosis. There are other causes also for scoliosis, like if there is any bone-related problem in the spine since birth. This is known as congenital scoliosis. Other reasons might include when the nerves or the muscles around the spine are not working well. This can lead to neuromuscular scoliosis. So these are three most common types of scoliosis seen in early childhood or in early adult life. Now, what are the most common signs and symptoms of scoliosis? First is uneven shoulders. That means both the shoulders are not at the same level. Secondly, one shoulder blade might be more prominent. Third, the waistline or the hip line is not equal. That means they are not horizontal to the floor. Normally, first notice of scoliosis happens when the person becomes aware of the fact that his clothes are not fitting properly and he is leaning to one side. Normally, there is no pain in case of childhood scoliosis, but in adults, it might be associated with back pain. Normally, there are no nerve-related symptoms also. Now, how do we diagnose scoliosis? First is clinical examination, in which you see that both the shoulders are not at the same level. That means one shoulder is up and the other one is down. And there is a C-shape or S-shaped curve in the spine. Now, when with such a problem, you will go to your doctor, he will get an X-ray done, and X-ray will correctly point out if there is any scoliosis. Also, sometimes we do MRI to study what is the reasons for scoliosis and what is happening inside the spine. Now, it's not like that every scoliosis requires a surgery. Sometimes we just see what is the age of the patient, what is the degree of curve, how much growth is remaining and what are the symptoms. Sometimes we just say let's do regular monitoring and no surgery is required. Sometimes we go for non-surgical treatment, especially when the child is in the growing age group, the curve is progressing fast, or medically we feel that this particular sort of curve can progress faster. Then we go for regular follow-ups along with scoliosis exercises, sitting posture training, and sometimes we also give brace, especially in case of growing children, to stop the progression of the curve. But when nothing works and the curve goes beyond a certain degree, then sometimes surgery is required. Surgery is required in cases when the curve is severe. Normally, more than 40 degrees of Cobb's angle is a medical indication for surgery. Or sometimes curves just keep on getting worse and worse even after bracing. Sometimes the deformity becomes very severe. Then also surgery might be required. Also, there are few medical indications where surgery becomes very important, especially if the patient is having breathing problem or nerve compression related symptoms. Normally, goal of the surgery is to correct the deformity, balance the spine and prevent progression. So with these three aims in mind, we do the surgery. Now, modern scoliosis surgery is a very safe technique of correcting scoliosis. We use special metallic implants to correct the deformity. To increase the safety of the surgery, we use special techniques like neuromonitoring and also 3D technology like robotic surgery or O-arm navigation to assist us during the surgery so that the surgery becomes successful and complications like paralysis do not happen. So normally surgery is not required for everybody. It is not required in every case also. But if you are suffering from scoliosis, definitely go and see your doctor. He will advise you X-rays or MRI depending on what he feels. But if you are suffering from scoliosis, don't worry, see your doctor, and whatever is the right treatment for you, go ahead with it, start your treatment, and you will have a normal life.